Ready? All right. Well, guess what? We were not ready. But we're ready now. So, Reflect and Reset with Maria and
Gina.
My partner in crime.
Yes.
My friend.
In our new studio.
Yeah,
we
look
are
at this.
fancy. Look, you see our name, Formé Medical Center back there. We don't fool around, guys.
We are actually utilizing one of the rooms in our waiting room at Formé Medical Center, our beautiful urgent care and internal medicine.
Yes.
And we're very excited with this show. We decided to actually go live today.
Yeah.
And just Gina and I to talk to you about what is happening in healthcare. And there's a lot going on, right, Gina?
Yeah.
You want to talk to them?
So let me tell you first about what's happening on the federal level, right? So we have some issues happening with the president and what's happening with public benefits. And for anyone who doesn't know what public benefits are, that is a Medicaid, that's Section 8 housing, those are food stamps. So what the regulation says is the president's saying, if you are coming here and you want to be part of the United States, you have to be self-sufficient. He does not want the taxpayers supporting you to live. So what he's done, and I've done a lot of reading on this because this is really very important, is that what he's done is that he's actually said if you are applying for any type of status, immigration status, residency, or a working visa, you want to extend your working visa, if you are being supported by any of the public benefits, you're going to be denied.
And what is happening with this, unfortunately, is that there are a lot of people that are insured by, many of the plans have the essential plan. And what we find out is that, let's say that you are a resident of the United States,
Yeah.
and that you are in the process of you want to become a citizen, because a lot of people now want to become citizens because everybody's concerned of where the country is going. And if you're utilizing those benefits in health insurance through the Affordable Care Act, you will be penalized.
Yeah, so I think what was happening last year when this first came out is that you were going to be looked at negatively for your application. But now he's saying you're going to be flat out denied. So what's happening is our representatives that are working here, the Fidelises and the Health First, are coming to us and saying people are coming to them and they're opting out of their plans.
And everybody's very scared.
Very scared.
I mean, as it is, especially the community, the immigrant community is already extremely scared. And what we find is that, for us, our heart breaks because we are trying to make a difference for everyone. But we also see that the effort that we've been putting all these years, 4 years next month, is actually, we can see that we can help so many people. And that's what Formé is about, helping our community. Correct?
It's true. No, it's true. And the other thing is that what the falsehood is that people think that, well, you know what, I don't need insurance, I'm not going to get the membership. If I get sick, I'm just going to go to the emergency room and I'm not going to pay. And that is not right. That's not that it's not right, that's another negative against you because they have your information. They know that once you stop paying, then the hospital has to be subsidized by Medicaid. And again, this is another mark against them. So you guys, we're saying this, if you know of anybody who's applying, you guys have to be smart. Don't think you can get around the system because the federal government does not fool around. We have a president that is like, he's out for blood, and we're trying to protect you. So this is not about, come to us. This is about, if you need health care, we're here and we're your advocates. So even if you have a question, just call us.
And I think, get informed. The idea is, we are ourselves getting informed with these changes. And I suggest that, if you do have a lawyer, that you call the lawyer, that you find out exactly how this is affecting you. And that do not act out of fear. without really getting to know what the information is.
Right.
So it's more because we're getting to know more about this.
I'm reading all the articles.
Yeah. Gina is becoming the expert, and she's been reading, and we've been really focusing in trying to figure out a way to support even the representative, like we said, that have the affordable care insurance, like Fidelis, MVP, all of Health First and Emblem. So we're here to support the community. But again, I cannot repeat this enough. Just get informed. You can go online, you can read about this, you can understand how it's affecting you. But Gina, we were talking about the fact that the healthcare system is so broken. And this is just adding to the fire.
Yeah, fuel to the fire.
Fuel to the fire. And we have to really work hard in trying to make this break into this system.
Yeah. You know what we found out and from somebody is that the number one cause of bankruptcy is medical insurance, medical care. People go broke, they go bankrupt because they can't afford their medical bills.
Because there's no transparency.
There's no transparency, and you think you're going to the hospital, you think you're gonna have a little CAT scan. A little CAT scan with us only costs you like $250. A little CAT scan at the hospital could cost you up to $2,000. So it's like, and you don't know that until you get the bill. And not only did you get the bill for the CAT scan, you get the bill for the guy who did the CAT scan, the guy who read the CAT scan, then the doctor who came in and spoke to you about the CAT scan. So it's a big conglomerate of people working together to try to get you better, yes, but it's going to be a cost. It's a huge cost.
I mean, I've said this before in some of the other lives, how I ended up going to the emergency room and I came out with a $3,000 bill. And $1,300 of that was a CAT scan. A CAT scan that our patients pay $250 for. So look at the overpriced. Everything is overpriced for the uninsured community, because it's not even like the insured community. The insurance are not paying that amount. There is no insurance that is going to pay the hospital $1,300 or $1,300 for a mammogram.
No way.
Right?
No way.
A mammogram that our patients pay $100. And the idea is, what we're proving here is that the system is overpriced and completely inaccessible to the community. And what we find, Gina, is that a lot of people, they just don't go to the doctor.
They don't go to the doctor until it's too late.
Yeah.
And then they get too sick, and especially if you guys are suffering from chronic diseases and you're not maintaining the care of that, you're in trouble. You're in trouble. You're going to end up, a diabetic's going to end up with an amputation, or to so severe that you can have kidney failure. There's so many things that can happen that you just don't realize. Because you're not symptomatic doesn't mean your body isn't creating issues against itself with these diseases, and it's scary.
It truly is. I mean, the fact that there's no transparency, we've talked about this, like, where do you go to buy anything that you don't know how much you're going to pay?
Right. Oh, let me go and buy let me go to Target and buy a TV and not know until I get to the register that it's $20,000. I mean, it's absurd. It's absurd. And actually, we talked to the Department of Health yesterday, and Maria and I are advocating for our members to try to help us get more members and get out there, and they're very for us. And they're even saying the same thing. We know it is broken and it's not transparent.
Yeah,
it's terrible.
The transparency is definitely an issue. And the other thing is that then, because of the poor transparency and poor accessibility, then people, we go back to, they don't get the colonoscopy when you're supposed to, you turn 50, you're supposed to get a colonoscopy, but a colonoscopy costs thousands of dollars for people that don't have insurance. And even if you have insurance, because of your high deductibles, like I have $2,500 deductible, we're paying close to $900 a month. $900 a month.
And we're not even utilizing. I mean, think about it. And you're never going to utilize it. It's almost like catastrophe insurance, because by the time I hit the $2,500, the year's gonna reset, and I'm gonna have another $2,500 to hit. So, even for people with high deductibles, the membership's right for you. Because think about it, you can get all your medical care for, if you need primary care for $60 a month. $60 a month, you don't have to worry about your deductible.
Yeah.
You don't have to worry about hitting it.
We always say, I say this all the time. Gina jokes that I say if you don't have insurance, I mean, it is crazy not to be our member, because our membership is here to support you, to support this broken healthcare system, and be able to, not just here, but if you go out. I was talking to you about this. So we had a situation where we had a member that is making about $140,000 a year, which is a nice salary, right? Everybody would say. But he says, I have 2 young children. I have a wife that doesn't work, because by the time you pay the babysitter, then you end up not really making enough.
And just because you make $140 doesn't mean you bring it home.
Exactly. He was saying
after
that.
Uncle Sam takes all their taxes, they're taking 30% from you. You're already down to 60 and change.
That's what he says. And then he says, well, it was going to cost me close to $2,000 to insure my wife and my kids. And then what he ended up doing is he insured the kids, because you can get insurance for the kids a lot cheaper. And he is without insurance, and his wife also. So he ended up in the hospital with a kidney stone.
Oh, wow. Oh.
And he had a bill that was $10,000. $10,000. He was in the emergency room for 3 hours, and he got a $10,000 bill.
It's disgusting.
But
it's disgusting.
I got on the phone with the hospital, and I started to negotiate and support this member. And that's what we do. That's why, there's loving kindness here for our community. This is our effort to really be able to support you, whether you come here or whether you are outside of here. But let me explain something to you, that we are so devoted to this mission that it doesn't even matter if you're a patient here. Because remember the guy from Connecticut that there was malpractice done on this poor guy. And he found us on social media. And he came here and he said, I live in Connecticut, it's too far, but I see how you guys are helping the community and I need help. And I ended up calling a lawyer. I ended up sending him to other places that were going to help us. And I'm sure he's watching us, because he's one of the biggest supporter of us. And he's never been a patient here. So we want you to know that whether you're a patient here or not, we are here to support you and care for you.
You're not getting that anywhere else. I'm sorry. I love my doctors, and I love, if my doctors are here now, but they weren't before. And they weren't going out of their way to help me like that. They weren't making my appointments, go get this appointment, go get this. And it's hard enough for us to navigate the system, but now you can take somebody who really doesn't know anything about healthcare, and we have, between us, 50 years experience between the two of us in healthcare. Then you get somebody who doesn't understand anything about the healthcare system, and now, okay, you need an MRI, then you need this, and then you need this. They'd be like, what do I do? Where do I go? And that's what we do. Our patient navigator, right?
Yeah.
Will help you get everything that you need.
And we've decided to really do a spotlight on all of the people that are, all the partners that are actually supporting this, this plan. This is not just a Formé effort. This is a community effort, because we have, like we said, sunshine, all the followers. I know, you follow many of our posts, and we talked about our pharmacy. We have our dentist. She was actually here on Monday.
Yeah, she's lovely.
She's a wonderful person, community and mission based. And we're going to be featuring Quest. And we're going to let you know about all the different partners that we have, because this is not just our mission, it is the community mission to really make an impact in the healthcare system.
And it's, you don't realize, but it affects your neighbor. It affects so many people, because it's not because, you're a lower income. Some people are coming off their, like the millennials, right? They're coming off their parents' insurance, and maybe they're making $30,000 or $40,000, and by the time they come home with their paycheck of $600 a week, they can't afford to put $700 or $500 to $700 out for insurance. So they're the healthier population, yes, but it's also, I like to say, you're flying without a net.
Yeah.
So because you don't know what's brewing, especially today, it seems like everybody's sick.
Yeah.
And you
well, it's the stress. We live in such a stressful environment. I got to tell you that. I do all my mindfulness. Which I embrace mindfulness every day. We were talking about today how important it is to have a morning routine, and this is all about health, right? So if I didn't have this strong morning routine that I have, it would be really difficult to confront some of the challenges that you get, especially with us, with this mission, and a mission that is a young mission, because it is young and something that we've never done before. So the challenges are tremendous. But when I do my meditation, when I went for my run today, and I realized how the stress, I feel it just decreasing, because I woke up today and I said, my God, there's so much going on. There's so many challenges that we have. And this has been a challenging 2 weeks. Yeah. But if I didn't have that morning routine and the meditation, meditating is so important. So it is, we want to help our staff. We want to help everyone.
And it's also, don't fret about something you can't control. So if you're sitting in traffic and you're in traffic, but the way you look at a situation is the way the whole day starts. Yeah. If you get up and it's always said, oh, it's raining out. Oh, it's going to be a miserable day. Then you know what? You just started your day off miserable.
Yeah.
You have to start your day off, as I like when you said to Natasha that, oh no, look how beautiful, everything's going to be so green and we're feeding the flowers. And
this is God's way of feeding nature.
Yeah, but think about it, right? So you started off, instead of it being a negative, you started off with it being a positive, and then it just kind of snowballs that way.
Yeah.
Or it snowballs the other way, which you don't want. And it's so easy to get yourself out or into that mode. But then today we actually had a meeting, and Maria said she had a little bit of frustration this morning also, even with her meditation. Then what did we do before we started the meeting?
We meditated.
The team meditated.
I said the team has to meditate so that we could start fresh and clear, with a clear foundation.
And just so you know how serious we are, they were knocking at the door and we didn't even acknowledge
Nobody
it.
moved.
Nobody moved. I was going to say, go into the door.
So by bringing this back into, healthcare, so what we're talking about is mindfulness right now, but let me explain that mindfulness and stress cause the mental health issues that we have.
Yeah.
Which is part of the healthcare system. And if you think about it, even if you have insurance, going to a therapist is unaffordable. So most people charge $250, $300
ridiculous
for a therapist, and the insurance companies, most of them don't cover it. And if they do, they don't pay enough to the therapist, so the therapists don't take the insurance.
Right.
And then we're looking at trying to support our community, and we even struggle with this, where we are working with nonprofit organizations that are there to support through mental health, and they have a month, 2 months
they
wait.
can't get an appointment.
You cannot send somebody that is depressed, or you have to figure out a way. You either put them on medication, but what happens with the medicine, especially if you aren't insured? How do you afford even depression medication?
It's the only answer. They're very fast to put you on medications, but you don't have any options to sit there and talk it through. As that clock ticks, the price tag goes up. And that's what we're trying to bring. So we're trying to bring mental health here.
Yeah, we're working hard on that piece, and
affordable.
Yeah.
Affordable. And that's really the key here, because it's not reachable, and these kids and people are suffering because they just can't get the help that they need.
If your mind is not right, it affects your entire body. It's really sad. But we consider ourselves the, what do we call us?
Oh, the rebel rousers.
Yes.
We're the rebel rousers.
Because we are having these difficult conversations that a lot of people, might not want to have.
We don't care. We're at the point where we don't care. And not care in a bad way, but care to the point where we're two little women making a big impact. Because I can say anything I want about these insurance companies. They gouge, they take total advantage. The executives are making way too much money. Not just executives in the insurance companies, hospital executives. They're making millions and millions of dollars. But yet who's paying for that? We are. We're all paying for that. Right. And now doctors can't see you because the insurance companies lower their rates to the doctors so they can make more money in their pockets. And so they have to pack in 40 or 50 in a day. So you literally get to see your doctor for 3 minutes. And he's supposed to get all the information he needs on you in 3 minutes. Yeah. And then he sits in his computer and has to back up all the data, in his computer so he can submit to the insurance company and get $60. $60, but they're walking away with millions in their pocket. It's disgusting. And we don't care.
Yeah.
We don't care. We're saying whatever's on our mind. We don't care.
And you might agree or might disagree because some people might disagree.
Well, you probably work for the insurance company. So for all you guys in the insurance company, you have a problem, give me a call. Because I am fed up with all of you.
Oh boy.
Yeah, I'll take you on. We're going to take you, we're going to take you on. Remember that bat?
Yeah.
Throw it.
Yeah.
See how far we get out of the park.
We were extremely serious about the work that we're doing at Formé, and that's why we wanted to really talk to you about the new changes that are happening. We are going to be speaking more about this. We are going to be bringing some immigration lawyers that can give you more information, and we're going to be educating our community. This is the purpose. That is why we go live. We want to make sure that we are communicating with you, that we're giving you information, that